A lot of people ask, what's the process? What happens in the journey through to making the right diagnosis? So I will see patients in my clinic. We do a very thorough history taking to truly get to the bottom of what's going on, what the patient's symptoms are. This is their opportunity to talk their way through their entire story. We then do a really detailed examination of the relevant joint, whether that be hip or knee. And then from that will lead us on to investigations. Investigations we usually perform are X-ray and MRI scanning. Sometimes we need to do CT scanning, occasionally ultrasound scanning. But usually we'll start with a couple of different types of investigation which add and give me information. And then when we put all of those three things together, we can then make our diagnosis. Now, when we have our diagnosis of exactly what's going on, we then actually have choices. And these will all be discussed in detail, and there'll be pros and cons to each choice, and some of those choices will be appealing to some patients and maybe less appealing to others. That then leads us on to the final decision making in terms of how we're going to do things. We discuss that in great detail, including potential complications, outcomes, return to sporting activity. And that's usually the journey for the patient.